I made a new type of coffee. It's coffee and chai tea put together, and I call it a dirty chai.
Oh, you can just call it a choffee.
Coffee. Hey everybody, this is Alan Sardana with SeamlessMD, and we're joined as always with our co-founder and CEO at SeamlessMD, Dr. Joshua Liu. Hey Josh.
Hey Alan.
On today's episode, we wanted to dive into a topic that we explored in our first episode, enhanced recovery after surgery. We thought, that topic in itself can probably fill up a whole library of podcasts, but today we wanted to at least explore that topic a little bit further.
Let's do it, Alan. Let's do it.
Sounds good.
By the way, if it's okay, Alan, I want to preface this with, Alan and I are not going to pretend to be enhanced recovery after surgery experts by any means, but I think, having worked with a lot of, thought leaders and clinicians who have done enhanced recovery for many years at their institutions, and we've supported them with, digital patient engagement on SeamlessMD, we just learned a lot. But I think we've also developed some pretty unique insight about how digital patient engagement fits in well with enhanced recovery. I think that's for more of what we can share. But anything that Alan and I say clinically about enhanced recovery, someone's going to have to fact check that with really good clinical experts, and hopefully we do it justice though.
Absolutely. I think maybe to start the discussion, I know we kind of went into it last time, explaining, what is enhanced recovery after surgery, but I think it is probably beneficial to summarize that again. Would you be able to kind of kick that off and explain, what is enhanced recovery, and maybe some of the origin, the history of enhanced recovery as well?
Yeah, definitely, Alan. And I think, as patients, we kind of always assume that if we're ever having something like a surgery, that our healthcare team or our surgeon kind of has all the best practice, latest steps in the healthcare protocol being used, for us and with us. But the truth is that, medicine varies around the world. The truth is that, people are learning about new and better ways of taking care of patients all the time. And frankly, what you find around the world is that for some reason, even if you're doing the same heart surgery in different, cities, or even frankly, hospitals in the same city with the same population, outcomes vary, right? Like at some organizations, patients recover faster, have less complications, go home sooner, don't come back as often. And others, it's worse. And I think what we find is that being really good at the actual surgery in the operating room is one thing, but a big part of a successful outcome for a patient is, well, what happens to them when they're preparing and what happens when they're recovering? And if we do those parts well too, the patient truly has the best health outcome. And what you find is that there are different ways of preparing a patient and helping them recover. And there are certain steps that just are better than others. And, for example, before we get to actual enhanced recovery, like many years ago, people would always tell patients to stop, let's say, drinking, water at midnight and just go completely dry until surgery at 8 a.m. the next morning. And then at some point, some really, really brilliant clinicians figured out that actually, if you let patients drink clear fluids up until 2 hours before surgery, they actually do better afterwards. But what happens in medicine is that just because someone figures something out doesn't mean that all of a sudden everyone in the world just starts doing that, right?
Yeah. There's not like a universal, booklet saying this is how you do your surgery. Everybody kind of has their own approach to it and wants to standardize in their own way and have their own protocols in it.
Yeah, and part of it too, Alan, is like, medicine moves so quickly, and a lot of times, like what you learn in training or you learn from your peers around you, that kind of sets the stage for what you end up doing in practice. But you're right, there's no like governing body that says, hey, everyone, this is the right way to do things. And it's probably better that that doesn't exist, because that way, providers can kind of figure out over time what works better. But basically what people realize is that, number one, there are certain steps in preparing and recovering a patient that are just better than others. And then two is that once you figure out what the best steps are, you should be standardizing that. Like if we know something works, like every patient should be getting that sort of care pathway.
Mm-hmm.
And so long story short, I think back in the 90s, starting, in Europe, some, clinicians figured out, hey, like there are certain steps that if you get everyone in our healthcare team having the patient do before and after surgery, they just recover faster. And over time, steps included things like avoiding opioids, carb loading patients before surgery, getting them, mobilized and walking sooner after surgery, doing certain exercises. And so the idea is that over time, these steps got formalized into these standardized protocols. And I think at some point, in the 90s, they started formally calling it first, I think, fast track surgery. And eventually the term enhanced recovery came about. And so, it became a very, I think, standard thing across Europe in the 90s. And then it came to North America. And I believe McGill was the first hospital in North America, I think sometime in the mid 2000s to do enhanced recovery here. And then after that, it started spreading across North America as well.
You mentioned there's no governing body that's saying, here's what you have to do. You have to follow these steps and exactly like that. The way that societies kind of disseminate best practices is through research. Everybody comes together, shares what they've done, shares their findings, and through discussion on those types of forums is where you can kind of understand what the best practice is and then move the needle across the world and across different hospitals. And so when McGill brought it over to North America, the enhanced recovery protocols that were first established around in the colorectal surgery space, was that as a result of an international society for enhanced recovery, or do you know when that came about?
Yeah, so I don't know the exact history for how McGill learned about it, but I do know that McGill is a center of excellence for, enhanced recovery after surgery, or ERAS. And I think that accreditation came from, to your point, this international body called the ERAS Society. I think you just go to erassociety.org. And it's a fantastic international body that basically both has guidelines for what would be an enhanced recovery pathway for different specialties. So they have, like, if you go to their website, there's an enhanced recovery protocol for gynecology and colorectal and, hepatobiliary and all kinds of specialties. And then also they do training and accreditation of enhanced recovery. So that way, if there was a center that wanted to learn how to do it, I guess, quote unquote, properly based on the way they do it, they can teach you and then you can get accredited for it. And I think there's other things you have to do to kind of maintain your accreditation. But I think McGill might have learned it from that group in some way, but I believe they are one of those accredited centers, actually.
Yeah. And then obviously, in this industry, we're a little bit stubborn. So if we don't want to change the way that we're doing things, we've been trained in a certain way, it's working for us, we have, relatively good outcomes. I think one of the biggest challenges that I've heard of in the enhanced recovery space is how do we get our physicians to actually standardize, to use these best practices, to use what's working, with the actual evidence out there, and how do we adjust that? So I think what you were getting to is the Enhanced Recovery After Surgery Society. Part of their work is to help institutions standardize and to rally the different physicians around what is working today.
I think, Alan,
go ahead.
Sorry, I'll let you finish.
No, I mean, I was just going to say, evidence-based is great, but I think implementation is just as important.
Yeah, so Alan, I'll tell you kind of like, if it's okay if I riff off in something kind of tangential, to me, like, enhanced recovery after surgery is like one of the most exciting innovations that has happened in healthcare. And the way I think I have a different definition of healthcare innovation than a lot of people. So in my mind, first you have an idea, maybe like a problem you're trying to solve, and then you can, you end up creating an invention. So to me, like, an invention would be something like, okay, I figured out a solution to a problem and I've implemented this invention in my clinic, in my department, in my hospital. And there are a lot of people who would just say, okay, well, that's an innovation because it was novel and innovative. My personal definition of innovation is that it's not truly an innovation in healthcare unless it disseminates and spreads to other clinics, departments, other hospitals. Because when you actually fundamentally change practice in many places, then in my mind, that's a real innovation. And so what makes, to me, enhanced recovery and innovation is not the fact that, someone did it in one place. It's the fact that it's spread like wildfire around the world, and it's changed practice. And I think one of the other neat things about enhanced recovery, to your point about like, how do you standardize it? How do you get everyone doing it? Enhanced recovery helped healthcare teams realize that patient care truly has to be about a team. The neat thing about enhanced recovery, and the hard thing about it, is that one person can't do it. So enhanced recovery is not this innovation that you just buy this product and then you can use it in the operating room and the patient gets better, right? It's not like a pill the patient can take and they get better. You literally have to bring physicians, not just like surgeons, anesthesiologists. You have to bring nursing into the room, physiotherapists, social workers, pharmacists, sometimes IT administrative people, project managers,
dietitians, for instance.
Dietitians. And for the first time, people have to actually work together and design the steps in these pathways. They have to agree on how patients get educated. They have to agree on what medications, pain management protocols go into this whole thing. And they have to actually, and in many places for the first time, these people are sitting around the same table to design these enhanced recovery pathways with the shared goal of like, let's give our patient the best outcome.
Right.
And like maybe in any other industry, it sounds crazy that that's not a normal thing, but in healthcare, when we're often so siloed, this is actually probably an exception. People actually get together and like try to make things better for the patient. And to your point, that's the most difficult part, I think, in the beginning. It's like, if you want to do enhanced recovery in your organization, you can't just be one like surgeon doing it for my patient, because you have to get your partners on board. You have to get other staff on board and get them in a room. And that's the hardest part, right? Now, once you get everyone like bought in and saying, okay, we want to do this, we're willing to like standardize the pathway, then the question is like, well, how do you actually like deliver a standardized pathway?
Right.
Right.
I imagine one of the first steps is kind of mapping out what does that patient journey look like today, and where do we need to get it to, as a first step.
Definitely. And just something like for like the 5 people who will watch this, just so that I make this clear, like there are a lot of steps in enhanced recovery that aren't patient focused. Like there are things that you're doing in the operating room, and like antibiotics and medications, or very clinician specific protocols. I think the parts of Alan and I that we are more engaged with is on the patient end, which is like, what are the things in enhanced recovery that the patient touches and is engaged with and has to be compliant with, and I think that's more like where we can speak to, just so that people get it.
Yep, totally. And so I do want to almost tie this back to SeamlessMD and kind of what our experience has been with, because we have implemented enhanced recovery with different groups over time. So obviously they did have that multidisciplinary team. They came to the table and they agreed, this is something that we want for our patients. That was the first decision. Have you had an experience where you've seen, SeamlessMD is really kind of a glue that helps bring these teams together and brings the discussions to the table?
Yeah, definitely. And I think one of the things that we hear from frontline staff as challenges in implementing enhanced recovery is, for example, number one, boy, there's so much information, more information the patient has to know for, if they get enhanced recovery. So it's things like, okay, now there's a carb loading drink. They have to learn about like what that is, where to buy it, why they should take it. There's things like, okay, they're avoiding like, narcotics more. Why should we do that as a patient? Or it's things like making sure they mobilize earlier. Like, what does that mean? Why should we do it? And so there's all these extra steps in the pathway that require really great patient comprehension and education, but there's so much information. And so if you just like overwhelm the patient with these thick booklets, not all that gets through.
Right.
And so part of kind of what we learned at Seamless is like, hey, number one, we can make that whole enhanced recovery education for patients less overwhelming and easier, because we're, breaking it step by step on the platform and, nudging patients reminders, giving them feedback, explaining in bite-sized pieces throughout their journey on the platform, and like why they should do it and when.
Right.
And then the second piece, I think, is just around like the fact that Seamless can be used as like a vehicle to ensure everything is standardized. So for example, one of the things that clinicians struggle with is, because there's so many team members involved and there's so many steps in ERAS, it's not uncommon that a team member might accidentally forget that, oh crap, like there's carb loading involved. I totally forgot about that step, right? Or like, oh boy, like I have to mobilize the patient on day one. Forgot about that. These are new things. Team members are switching all the time. New staff, are coming, old staff are leaving. And so SeamlessMD being kind of this digital backbone where don't worry if people leave or change or forget. All the steps are here. They're hard coded into the platform for your patient. They're going to get that information. Yep. They're not going to forget.
That's a great point. Yeah. And I mean, I've also seen clinical teams come together and start like a pre-op class for the patient and get the patients involved earlier and educating, in a class kind of setting. And so I think, obviously I've heard that quite a few times and we've been able to incorporate that education onto the platform. So it's almost like a supplemental piece for the patients where they can go to the class, they can understand the information, and then they can always have that with them wherever they're going.
Absolutely.
Yeah. In terms of, we're adding in all these extra steps. We have to carb load our patients now. We have to get them walking. Obviously, there are challenges that come with adding all these extra pieces for patients, especially because they're not always within our hospital. So as we add more pieces to the puzzle, how do we ensure that the patient is actually following these pieces and therefore getting that better outcome that's desired?
Yeah, and that actually reminds me, when we were at Sages, right? And I think that's the first time we met one of our current partners, Dr. Vrochides from Atrium Health. He was presenting about enhanced recovery after surgery for HPB, and one of the things I caught both of our ears was him saying, hey, it's not really enhanced recovery if you're not tracking compliance.
Right.
And for those, and by the way, we love that because we started understanding that importance and it made sense. And, one of the things that people don't realize is that you can't improve what you don't measure. And it's so important to measure our patients and providers actually following all these steps. Like what percent of the time are we following the steps? So that way we can improve that. So for example, like what percent of our patients are actually carb loading? What percent of the time are we, mobilizing them on day one? Or what percent of the time are we, avoiding narcotics or whatever the measures are for the organization. And the reason that we do those things, right, is because there's so much evidence on enhanced recovery now that shows with, and actually, for example, I know Dr. Feldman and team at McGill did a great study on this. They found that with every additional, step that the patient and the care team complied with in enhanced recovery, the shorter the length of stay.
Right.
So the more steps you follow, the faster the recovery and the faster the patient goes home safely. And so, but you can't improve compliance if you don't measure it.
Yep.
And so, one thing that the ERAS Society has done well is they've created this great, database collection tool, particularly around like provider compliance with enhanced recovery. So they have a whole database. It's called the ERAS Interactive Audit System, or EIAS, where clinicians can actually document, okay, like, yes, for this patient, we completed all the intraoperative ERAS steps and we've ordered the right, pain management protocols or whatever is in there. And then kind of what we've learned at Seamless is we've really helped on the patient end, right? Like we actually help patients track on our platform. We ask them, hey, did you do your carb loading? Yes. If not, tell us why not. And then we help the care team investigate why they didn't do it, or like, how many laps did you walk today? And the patient will record in Seamless, I walked, 5 laps today. And then we provide that data back in dashboard so that care teams know, hey, it could, as granular, we've had some of our partners actually at Bay State with Dan Engelman and Cheryl Kasafi, who run the cardiac enhanced recovery program there. The way they use SeamlessMD as part of their in-hospital care is if a patient says, no, I didn't, mobilize today, not only does the patient get feedback saying, hey, you got to work on this mobilization to recover faster, Cheryl's team gets a notification on the dashboard saying, hey, this patient didn't meet their mobilization goals. And then they actually might go in and help the patient mobilize so they can help that patient recover faster. And so we're closing the loop there on driving up compliance for the patient. But then also we have these, as you know, these aggregate dashboards where the care team can say, hey, over the past quarter, compliance with mobilization after surgery has been 90%, but compliance with carb loading is 50%. Okay, next quarter, we got to focus on figuring out how we can drive up compliance with carb loading. But that only works if you have the data.
Right. Yeah. And I think the quote that you alluded to, and that was Peter Drucker, what gets managed or what gets measured can be managed. So not only, tracking that compliance, but then you also mentioned, how we can take it to that next step and actually improve protocol compliance by using these real-time dashboards. You're able to see, what is the compliance for the population, for your patients, also for your physicians. And from there, we can kind of really kind of look at the nitty gritty bits of the data and understand, okay, well, maybe it is carb loading that's, lower compliance. So that's where we should focus our attention over the next month or quarter or whatever. We've name dropped a few people and alluded to different societies. I know there's been a ton that have popped up in the last 20 years. It might be worth mentioning, where the actual enhanced recovery societies are, and because they provide a tremendous amount of value for physicians across the United States and across the world internationally. You mentioned Dr. Vrochides at Atrium. I believe he was at that time the president or president-elect of the Enhanced Recovery After Surgery USA chapter, but maybe more broadly, there's a couple other societies that are focused on that same goal. Do you know some of those societies?
Yeah, so you mentioned ERAS USA. There's also, of course, the umbrella organization we mentioned earlier, just ERAS Society, the international, I guess, one in general. And again, they have a great list of guidelines, of enhanced recovery guidelines for different specialties. But there's also even clinical specific enhanced recovery societies. So, Dan Engelman is the founder and the president of the Cardiac Enhanced Recovery After Surgery Society. They're actually formally affiliated with the International ERAS Society, and they have done fantastic work in releasing cardiac ERAS guidelines. And in fact, the guidelines they released in JAMA last year is the most viewed online JAMA publication. So phenomenal accomplishment by that team, and they're really transforming cardiac care. But there's a number of other societies too. So the American Society for Enhanced Recovery, ASER, folks there like Julie Thacker and TJ Gann, launched that and done very, very well, and brought enhanced recovery to the forefront in the States. And then also, Liane Feldman also played a critical role, and Debbie Keller, and so forth. They were involved with the SAGES as their SMART task force for enhanced recovery, and that's been really important for advancing enhanced recovery for gastrointestinal surgery.
Yeah, truly. And I know that they run a ton of different workshops all the time, and they're teaching everybody, including new students who are even in school now. They're educating them on enhanced recovery. So I think that's really neat. Definitely the next wave of physicians coming down the pipeline would be equipped with some of this new knowledge.
And actually, Alan, on that note, I don't want to forget some of the anesthesia-led societies. So the American Society of Anesthesiologists, or ASA, has their perioperative surgical home initiative, which is pretty much overlapping with enhanced recovery. So they've really put that out there. EPBOM has done a lot of work with anesthesia, led enhanced recovery as well. So all of them did fantastic work. And I don't think it matters if you are part of all of them or some of them. I think they all do a great job of kind of bringing to light these best practices. And as long as you can find one of these communities to be a part of, you're gonna be up to date with these things.
Yeah, definitely. Also, I just wanted to make a comment. Dr. Dan Engelman, when he put out the recommendations for cardiac enhanced recovery after surgery and got it into JAMA and spread that like wildfire, he and his team really got it out there. Like I found they were on Twitter messaging all the time, and rightfully so, because it is the best practice of today, and needing to get that out. So I think by having it published in JAMA really speaks to the efficacy of what they're doing and what they're trying to get across to everyone. So that's really neat. And I think I got the sense like it maybe started in one specialty, but it's now it's in pretty much every specialty in surgery, which I think is really cool. That's just in the past decade, it's kind of spread like that. So
yeah, we've seen it in spine, neurosurgery in general, obstetrics, ENT, Pretty much most of your specialties, yeah, have some form of enhanced recovery. And, kudos to the frontline clinicians who are the ones really, designing and launching these initiatives and sharing them. I mean, really, it's become a global effort, which is phenomenal. And to your point, have to give a lot of kudos to, the cardiac ERAS group and Dan, because like, I agree with you. I mean, you and I were talking earlier today, right? Even in marketing, right? There's, you have your product, but you have to distribute it. You have to get the word out, or else people aren't going to know about it. They're not going to benefit from it. They've done a tremendous job with their distribution and getting the word out. Also, what was very interesting about their guidelines is that I think they're the only ERAS guideline that's actually specifically mentioned as a recommendation patient engagement technology as part of an enhanced recovery initiative. And I think they're the first in the road to ever do that. And I suspect that, particularly, I mean, honestly, with COVID-19 going on and more healthcare systems seeing the value of going, digital with, solutions like SeamlessMD, it's going to be eventually pretty common that these best practice pathways are going to recommend engaging patients digitally to keep them on track with these, enhanced recovery or similar pathways.
Yep, totally. Some of the earlier goals of enhanced recovery was obviously better outcomes for patients, but in particular, it was length of stay reduction. It was opioid sparing methodologies and use cases. Is there a correlation between enhanced recovery and adding that digital patient engagement component, tracking that compliance? Is there a piece where those two kind of mesh together really well to then further enhance length of stay or keep track of opioids? I feel like I'm alluding to it already, but do you want to touch on how that works with SeamlessMD or with the digital patient engagement platform?
Yeah, so I mean, on the length of stay piece, for example, Rush has been one of our earliest partners in using Seamless for things like enhanced recovery, and they actually just published a paper earlier this year on work they've done over the past few years, where they had implemented enhanced recovery for colorectal surgery for a couple of years, and they were successful with it. But then when they added SeamlessMD to their enhanced recovery initiative, which made patients even more compliant with their protocols by engaging the patient, day to day on the system, they actually saw length of stay drop by 2 days. They saw SSIs drop by 70%. They saw cost per patient on the inpatient side dropped by about $2,300. And the phenomenal thing is that these were all statistically significant results. Like, all the p-values were far below 0.05. And the phenomenal thing was that in their case, they didn't have staff around like monitoring patients all the time on the platform, but by just simply driving up better patient engagement, it improved those results.
Right.
And so what's incredible is that you have something like ERAS, where even when staff are manually doing ERAS, it dramatically improves the patient outcome. And then when you empower patients with the right system, like SeamlessMD, to actually stay compliant with the ERAS pathway, the results get even better. I mean, we saw the same thing over at our work with University of Alabama at Birmingham, UAB. The ERAS medical director there, Dr. Dan Chu, is like this brilliant physician who has helped to lead and grow enhanced recovery there. And they had a great enhanced recovery program already. They brought SeamlessMD in partnership, and they saw, I think, an average length of stay reduction in their colorectal program, a 1.6 day length of stay reduction after adding SeamlessMD, statistically significant. And again, they had a great program. We just were complementary to kind of better driving up compliance to it. And so we're seeing the power of empowering patients to just, hey, you already know the right things to do. We're just kind of giving you an extra system to make it easier for you to follow the steps.
Yep. And you mentioned Dr. Chu, which I think is obviously, he's a key thought leader in this space. I know one thing that he's very passionate about is health literacy. And you mentioned earlier, if you put together this enhanced recovery after surgery pathway, it could be 100, 150, 200 pages for a patient of education alone, just explaining, what they need to do, but then more specifically, why they need to do that. And obviously, when it comes to health literacy and patients actually understanding the materials, I believe with UAB's group, we had to actually translate some of the education to a much lower grade reading level so that their patients could actually understand the material. How does health literacy play into enhanced recovery? And then how does SeamlessMD help with health literacy and patient comprehension?
Yes, I mean the neat thing about, I guess, here at Seamless, and I think it's which is that every organization approaches patient engagement slightly differently. Early on, we really invested in accessibility on the platform, and that doesn't just mean the tech accessibility. Like, I mean, it's like the tech it's been colorblind tested, contrast tested, font size tested. But particularly because, Denice, our director of patient education, who, by the way, I told her that you're probably going to wrangle her into one of these shows at some point to talk exactly, about this. But, she really emphasized early on with the company the importance of health literacy. And so, typically in our standardized pathways on Seamless, everything's at the grade 6 reading level or below. But to your point, I think at UAB, given some of the demographic there, I think with them, we brought it even further below, maybe grade 5, maybe less. But we know it was important. And actually, the reason we know it's important is because actually Dr. Chu's team did a study where they looked at, patient engagement on Seamless compared to health literacy of the patients. And what they found and what they did was they actually had patients on Seamless also complete a health literacy score on the platform. They found that there was no significant difference in patient engagement levels on the platform, regardless of the health literacy level of the patient. And I think their hypothesis for why is the fact that because we brought it down to like the grade 5 reading level, it made the experience accessible to everyone. And there's tons of data showing that health literacy is tied to outcomes. And so I think, we've really cared about making sure it was accessible from both a content and a tech point of view. And I think to your point with enhanced recovery, where there's just so much stuff in there, it becomes even more important to do that. So I want to say kudos to Dr. Chu's team at UAB. They've been a leader in health literacy and patient education for surgery in particular. And it's been cool to kind of help support that.
Mm-hmm. Dr. Chu, we've talked with him before. We've even interviewed him on the topic of enhanced recovery. And I think another kind of neat point that he made in the past was that, currently, and especially in the past, we were focused on these harder metrics. When we were implementing enhanced recovery, we're looking at length of stay, we're looking at opioid use, we're looking even at readmissions. And Dr. Chu alluded to the fact that, with this advancement in enhanced recovery and then having patient engagement and being able to follow our patients and track compliance from the different steps in the protocols, he mentioned, PROs and patient reported outcomes will kind of be that softer metric that we need to start shifting and looking at, especially as we're focused more on patient-centered care and making sure that it's value for the patient. So actually understanding, what are patients reporting throughout their journey. How do you see PROs playing a factor in enhanced recovery and with SeamlessMD obviously being able to collect those reported outcomes? Where do you see PROs fitting into this equation?
Yeah, and maybe just to backtrack for anyone who's watching who isn't as familiar with patient-reported outcomes or PROs. I mean, the basic idea is that, as providers, we collect all kinds of information and outcomes and metrics from patients that we think are important, but often what's been missed historically is what's the patient's perspective on what's important and what outcomes matter to them. So, for example, if a patient has a knee replacement surgery, as a clinician, we measure things like what was the complication rate, what was the infection rate, what was the blah blah
mortality,
blah, mortality. But as a patient, you ask them what's important to them, they would answer things like, oh, like how much pain do I have, or how far can I move my joint, or even specific things like my goal is not to have a 1% risk of complication. My goal is to walk my daughter down the aisle at her wedding next year, right?
Right.
And so, the whole world, and including, governments and insurers and clinicians have realized that, hey, the patient-reported outcome, the self-reported, metrics from patients really, really matter because it tells the other side of the story. And so, for example, in the US, we're seeing, payers and the government for things like total joints have now kind of required patient-reported outcomes to be collected. So different validated survey tools. And so I think a lot of folks in enhanced recovery, like Dr. Vrochides and Dr. Chu and Dr. Engelman and others have realized that, hey, like patient-reported outcomes matter a lot for enhanced recovery as well. And so, to give you an example, the group at ASER, right? They actually came out with a really, really good paper back in 2018, where they basically had this kind of like a consensus statement on, what patient-reported outcomes should you consider collecting across enhanced recovery pathway? How often should you collect it? So I think it was things like the Promise 10 survey, I believe, the Quality Recovery 15 survey, and so forth. And so, their experts in enhanced recovery are starting to see the value of that. And I know, for example, like you mentioned, Dr. Vrochides and Atrium is big on that. And what's interesting with Atrium Health and the work we've done there for enhanced recovery is not only are they collecting these standardized surveys like the Promise, et cetera, but they've chosen to collect some very novel patient-reported outcomes as well. So, for example, we're tracking opioid consumption after surgery there. And so every day in recovery at home, patients are asked, not just what your pain is, but actually what which did you take any opioids today? Which ones did you take? How much did you take? And then they actually have these kind of reports and dashboards that show them like how much opioids are patients taking in recovery. Mm-hmm. And what's interesting is that actually last year at the ERAS USA conference, the team at Atrium Health presented results on the data they collected on the platform. And, what they found was that, patients were actually self-reporting that their average opioid consumption recovery was about, 10% of what the typical prescription was. Now, again, it's not a perfect data set, of course, and it's probably not exactly 10% by any means, but there's data to suggest that, hey, we might be, our standard for prescribing might be a lot more than what patients actually need. And the truth is that no one's going to change those prescription practices unless they get data to tell them, hey, maybe our patients don't need as much, right? Yeah. And so patient-reported outcomes become a very, very important way to close the loop on, on these protocols.
Right. And I imagine there's no end to what constitutes a patient-reported outcome. Anything that a patient reports could be taken as a patient-reported outcome. And I think that's another, I don't mean to keep bringing up SeamlessMD.
No, you do.
This is the SeamlessMD show, but
no, Alan runs marketing here, so his only goal is to market.
No, I consider myself a lifelong learner, and any space, anything that I'm learning, I like to really dig my teeth into. And so in this enhanced recovery and obviously opioid bearing is one of the main outcomes for enhanced recovery. But really anything can be a patient-reported outcome. And I think it's really neat how SeamlessMD can collect the voice from the patient. They can understand, what is a patient, reporting in any measure. So if you want to track the standard, quality of life kind of scores, but then also opioid and also anything else that you want to be collecting from patients. And I think what's really neat about that is then that dashboard aspect where you're able to really see the data and you can make decisions from that data. Educated and calculated decisions. So I think that's really cool.
Yeah, actually, Alan, I think to your point, what we're fortunate to have so many brilliant clinicians who are, innovating on the platform to collect all these really unique patient-reported outcomes. I mean, the neat thing about what we do is that, we collect, the validated surveys every 30 days or whatever. But to your point on Seamless, we're collecting literally daily patient-reported outcomes. That's not a normal thing most organizations are doing. We're collecting daily mobilization, daily pain scores, daily opioid use. And that provides a much richer data set to learn from than just, what was your pain 30, 60, 90 days after surgery. That tells a very small part of the story. And actually, one thing I want to bring up, Alan, because I think we forgot to do at the beginning is we never talked about how we learned about enhanced recovery. And that's a story that I'm very grateful for. So we brought up Dr. Liane Feldman earlier from McGill as being one of the pioneers in enhanced recovery in North America. But she was actually the one who taught us about enhanced recovery. So, we first met Liane, I think back in 2014, I want to say, maybe 2015. And when we were telling her about SeamlessMD, she said, Josh, this would be perfect for, enhanced recovery and helping patients with that protocol. I was like, what's enhanced recovery? I've never heard this before. Yeah. And so I need to give a shout out to Liane for basically teaching SeamlessMD like what enhanced recovery is. And actually, for those who are interested, we did this great study with her team several years ago where they actually, were the first to use SeamlessMD to actually collect patient-reported outcomes for enhanced recovery at McGill. And there's a great published paper about that. And kind of one of the key questions that they had was, well, will the data that a patient tells Seamless match what they would otherwise tell a human being? Because normally they were having a auditor go around and ask the patient, how far did you mobilize? What's your pain? All these other questions.
And that's like the gold standard.
Right. It's a gold standard, like asking the patient yourself, right? But then if you want to deliver enhanced recovery at scale and you want to collect data every day, well, you can't just hire people forever, right? And what they showed was that I think there was about a 90% agreement between what a patient would tell Seamless and what they would tell a human auditor. And so there was great validation that, hey, you know what, patients will tell the platform pretty much the truth around their patient-reported outcome. But I think, again, just want to give kudos to Liane, not only for kind of advancing enhanced recovery, but she, in my mind, with us, one of the pioneers of enhanced recovery and patient engagement. So want to make ssure that some of that origin of the story was known.
Definitely. Another point of contention that I hear all the time going to some of these society meetings and understanding the enhanced recovery ins and outs is there's a lot of skepticism around, if we lower length of stay, sure, we can, kick the patient out of the hospital early, but usually they're going to come back to the hospital for readmission. So how does SeamlessMD kind of fit both of that, or like really take a look at that equation and then solve both pieces? How does that happen with Seamless?
Yeah, I mean, the neat thing is that the platform is flexible and most of our partners use Seamless across the entire journey. So if we're talking about, surgery, patients usually get enrolled preoperatively. We guide them through the pre-op phase. When they're in hospital, it guides them through in-hospital recovery, like daily mobilization and all that. And then when they go home, it helps to engage them with not only their recovery plan, but then they check in digitally daily for at least the first month, telling us, on the platform, their pain scores, their temperature, photos of their surgical incision. And based on how they're doing, they get feedback on how to self-manage or when to escalate. But for some of our partners who are really hands-on with the data, they've chosen to get alerts and dashboards. And so, we have partners like, for example, going back to, at UAB or even at, Bay State, their nursing team is actually monitoring patients after discharge. And for example, there's a great case study we did with Bay State and Dan and Cheryl's team where they demonstrated a 72% reduction in readmissions primarily because they were able to monitor patients when they went home after their surgery.
Wow.
So they not only dropped length of stay by about 0.9 days, they reduced readmissions by 72%.
Wow.
And the platform was kind of an enabler for the kind of that safety net really for a patient.
Very cool. Yeah. So starting all the way before surgery with the patient enhanced recovery, their entire journey, and then also giving them that almost command center where they can monitor patients and reduce complications post-op, bring a patient back into the hospital if they need to, but kind of get that information right away. That's really neat.
Yeah, and actually, Alan, forget like those metrics, even like in just today's time with COVID-19, if you can, check in on a patient digitally on Seamless and just say, hey, you know what, you're doing fine. Like, don't come in person for the follow-up visit because of the pandemic. Even that's a good outcome because that's going to protect the patient and the staff from unnecessary risk of infection.
Yeah. And then I imagine, post-COVID and pre-COVID, even patients that are traveling, an hour, 2 hours, 3 hours to get to the hospital, that, a waste of everyone's time if it's a 5-minute visit, just saying, yeah, everything looks good.
Absolutely.
So having that ability, that's really neat.
Absolutely. Yeah.
Cool. Did you have anything else on the topic of enhanced recovery that you wanted to clarify for the audience or understand better?
No, I think the main point is that it's really important. It works. I still don't think it's as widespread as it needs to be. And I'll tell you, we still run into organizations where they say they do enhanced recovery, and then you look at what their protocols are, and they're doing like 1 or 2 out of the 20 recommended elements, and then there's still so much room to improve. But I would say the exciting thing is that there's so many of these individuals who, are promoting enhanced recovery, teaching it, and no one's paying them to do this. Like
Right.
these great clinicians who are advancing enhanced recovery are doing it on their own time, because they know it's the right thing to do for patients. And I think my hope is that 10 years from now, Alan, you you won't know what enhanced recovery is because it's a standard of care and it's just called like surgery. It's just called healthcare, right? The moment that happens, then you know that we've made it, because you don't have to call it something. You don't have to teach people this new thing. It's no, this is like what we do. This is safe, effective
Standard
surgery,
care.
right?
Yeah, that's really great. I think as well, obviously we'll link the show notes with all the various societies. All the information will be on there from, the ERAS International, ERAS USA chapter, ERAS Cardiac, ASER, SAGES, all of those we'll link to in the show notes. Josh, I've had a great conversation at this time. I've learned a ton about enhanced recovery from you even before this podcast episode, but every single time that I talk with you, I learn something new. And I'm really grateful to have kind of that knowledge that maybe Liane Feldman passed on to you, you've passed now on to us. And, that's how it starts. It just spreads from there. So thank you for joining today. That was really awesome.
Well, thank you for hosting and all the great conversation, the insight, and helping me relearn enhanced recovery as I share whatever I think I knew. But this was fun. Let's keep doing it. I don't think we know yet what the next show is going to be, but hopefully it's just as interesting of a topic, and I'm looking forward to it.
Yeah, absolutely. Awesome. Thanks, Josh.
Thanks, Alan. See you the next one.
Bye.
Bye.